Hello, in this video we will understand about the complication due to fasting in Ramadan. During the Ramadan, the fasting will lead to cause many complications for normal person, but especially for the diabetic person. Muslims around the world fast for almost 29 to 30 days, consecutive days from dawn to dusk in a year during the month of Ramadan. A lot of benefits about the Ramadan fasting, but the complication is minor for patient for diabetic person. So in this fasting, the water drinking and food eating, everything will be restrict and prayer is allowed, but the all uh, intaking things like food and water, drink, etc., which that will be inhibit even drug. Diabetes is a major problem for Muslim patients. So let's begin to understand how a lot of problems can arise due to the fasting in Ramadan. This is the person when intake food before the Ramadan fasting, during the before the Fajr time, and after the fasting the glucose will increase after the absorption of the food, and in this way the hydration will increase due to the intake of water more, and this glucose will trigger the insulin to release. Insulin will bind with a specific tissue, will lead to hyperglycemia, lead to hypoglycemia, and ultimately isoglycemia will occur for normal person. And the insulin like growth factor 1 increase into the liver will lead to glycogen formation, and hydration will be maintained, and in the form of the glucose will enter into the adipose tissue due to the insulin will lead to lipogenesis during the early time of fasting, but for diabetic person it will not occur normally. Let's begin to understand. Here is the blood circulatory system. So the glucose when increase, the rise of the glucose is known as the hyperglycemia. This will lead to this will should be hyperglycemia should be isoglycemia, but no insulin. In this way the insulin will not release, or insulin insensitivity will lead to increase the glucose in the blood circulatory system, and in this glucose will trigger the glycogenesis. Gluconeogenesis will be decreased due to the uptake of glucose will decrease, and in this way this decrease of the glucose will lead to ketogenesis in the liver and ketones production like beta hydroxybutyrate, and the glucose extra glucose will be excreted with the water through kidney, the urinary system. It means that dehydration will occur more. Remember, and insulin will not occur, so the lipolysis will occur, so the weight loss will increase more, and the lipids is used for the gluconeogenesis as well as the ketogenesis. Hypoglycemia will trigger the ketogenesis, ketones production, and the ketones will be entered into the blood circulatory system. A lot of ketones produced due to not glucose level normal. Glucose level low and dehydration will occur, and in this way the ketones will produce more and more as a positive feedback, and in this way the loss of the ketones from the urinary system will be more. In this way the more water will be excrete, and then more water will excrete with the ketone, because the excessive ketone is not good, and in this way the dehydration will occur more. In this way, the dehydration will lead to cause many problem. Let's begin to understand for normal person. A normal person. Here is the hyperglycemia occur during the eating time and glucose increase. Insulin trigger to hypoglycemia will occur, and in this way the isoglycemia will occur. Glycogenesis and lipogenesis will occur in the early phase of the fasting, and the late phase of the fasting, the degradation of the glycogen and lipids. And slow release in fasting will lead to no dehydration more as compared to the diabetic person. So the diabetic ketoacidosis will occur can be. So let's begin to understand for diabetic person the hyperglycemia and hyperproteinemia will occur in the blood circulatory system after the ingestion of the food, and in this the glucagon will increase but the insulin will not increase. Remember, and in this the more glucose will be as a solute will increase in the blood circulatory system, and when more glucose will enter into the blood circulatory system, hyperglycemia will require the excretion for balance, so the water will be lost with the glucose for excretion, because the excessive glucose is not good and require more water. But in this way, the hypoglycemia will occur with the water loss, and the lipolysis will occur. And in this, the isoglycemia will not possible. Lipolysis will be occur, and glucogenolysis will occur. Will lead to more excretion and more water loss. And the ketogenesis in liver will occur. In this way, the basically the proteolysis will lead to keto acids increase, and the water slow excretion will be inhibit, and in this the more water excretion through kidney for the excretion of the excessive ketones, and in this way the more water will not occur, so ketoacidosis, the diabetic will occur, will lead to cause shock, coma, muscle fatigue, hypokalemia, hyponatremia, weakness and loss of function of the muscles. Even the dehydration is the every part of the problem in the organs, and thrombosis can occur, and acidic the physiological disturbance will lead to cause even death whenever you will get a more severe diabetic person. So remember, in this video we have discussed about the complication due to fasting in Ramadan. So we have discussed the generally overview, the outlook of the diabetic ketoacidosis formation due to the fasting complication, and we have discussed for the normal person the weight loss will not occur for the normal person too much as compared to the diabetic person. Remember, and the positive feedback mechanism will occur, mean to more ketones excrete, because insulin will decrease, so the glucose will excrete, will lead to trigger more and more ketones.